My name is Michael Duarte. I'm from the Madera Coalition for Community Justice, and I will be tonight's moderator. This webinar, again, is a reminder, it's the fourth of our six-part series addressing the hospital closure. And tonight we have several people on a panel. We have Madera County's Public Health Director, Sarah Bose, Chief Medical Officer of Camarena Health, Dr. Joel Ramirez, and Director of Behavioral Health Services, Connie Moreno-Peraza, and local doctor, Dr. Mohammed Ashraf. Again, thank you guys for agreeing to join us. And so before we begin, I'll just go into a little quick intro, and I'm gonna cover some of the ground rules and updates. Like our previous session, we will start by interviewing our panelists. Halfway through this webinar, we will begin taking questions from the attendees. Those attending can participate by posting questions in the QA section, or you can raise your hand at the end of the session and we can unmute you. It's your choice. We will also put a link in the chat directing you to a discussion board where you can post more questions and talk with other community members. As for updates, next week, we will have Assemblywoman Soria and Senator Ana Caballero, or a staffer, as they discuss their recent initiatives to aid community members on what's next. This session will not have in-person options, so please contact us for Zoom information. The contact information will be put in the chat. And June 16th is also the last day to file a claim against the hospital. So visit, if you need more information on that, visit our website at maderaccj.org to get the link, or save the link below in the chat. So with that, let's begin with introductions. And why don't I get each one of you, of our panelists, to introduce themselves.
Hi, good evening. I'm Connie Moreno-Peraza, the Director of Behavioral Health here in Madera County. Buenas tardes.
Hello, I guess I'll go next. I'm the Chief Medical Officer for Camarena Health, Dr. Ramirez.
Good evening. I'm Sarah Boss, and I'm the Public Health Director for Madera County.
I think we're just waiting for Dr. Mohammed Ashraf, but I think we are in contact with him to see if he's going to join us or not. So since we're running a little behind due to our technical issues, we'll just go ahead and I'll just start by asking the panel some questions. Any of you can answer. And I just want to set the stage. It's been over 5 months since the hospital's closed. So what have you seen regarding what the community is doing? Where are they going, and who's helping them in this process?
I can get started. So in public health, we have been asking partners around the community a lot of questions with regards to what are the needs and what are people doing to navigate healthcare. Right away, we started with a Healthcare Connections webpage. We wanted to make it super easy for folks to be able to find resources. And so if individuals go to maderacounty.com/healthcare, and I'll put that in the chat for everybody to be able to look at that. There's information about how to enroll in Medi-Cal that's there. The urgent care clinics, which is information that I'm sure is duplicated on Camarena's website. And also the support services that are available through Medi-Cal, and a little bit of information about our mobile health van and where it's going to be and services that are offered there. We want people to understand that while the hospital is still closed and people would need to travel to Fresno to the hospital, there are still lots of resources that are still located in Madera County. And it's really important for folks to ask themselves, how is their health right now? What could they do in terms of connecting with a primary care provider that would help them stay out of the hospital? And if they do need to go to the hospital, they know where to go to find those supports. How do they set up transportation with their Medi-Cal provider if they have Medi-Cal, or with their healthcare provider if they have other insurance? For those who are not insured, we really encourage you to look into Medi-Cal, because there are so many more people who are eligible for Medi-Cal now than there used to be. And so to explore those options, and if you don't have any health issues, you're not really concerned, but maybe it's a family member, it's time now to look at every member of the family and find out what we can do to get them covered, either under Medi-Cal or other insurance, and what are those supports. So I'll go ahead and put that email address in the chat so people can check it out. If they don't have internet access, obviously they're on Zoom right now, but if somebody else needs to access that information and they don't have a computer, they don't have the internet, of course, you can go to the public library. But one of the easiest ways to get that information is to also call 311. There are people at 311 who speak English and Spanish, and they're not going to give you medical advice, but they can navigate through that website and provide you the information that's on the website so that then you can go directly to your doctor, directly to your insurance, and get your questions answered. The one thing additionally I'll add is if you do have insurance, I encourage you to look into the resources either through our website or by just turning your insurance card over to the back. There's typically a website where you can find information. There's phone numbers that you can call. And the back of your insurance card is a great resource for folks to be able to get connected to things that they need. So while we don't have a hospital that's in Madera County, we have access to services that can help you stay out of the hospital. And there is also our 911 system that is still operating. The response times, we have been monitoring the response times of ambulances. And I know that right now people are very, very aware and paying attention to those response times. And so sometimes we'll hear stories about it taking 15 minutes and it shouldn't take that long. We want it to be as fast as possible. The response times in Madera County were for the most urgent emergencies between 9 and 10 minutes in the city of Madera. They were between 12 and 15 in the rural areas of Madera. And those response times have remained the same. So the closure of the hospital does not prevent you from getting the same ambulance response that you did before. So if you have an emergency, do not hesitate to call 911 and access that service.
Thank you, Sarah. Any other of the panelists would like to address the questions? And just to remind you, these are broad questions. And the question was, what have you seen regarding what the community is doing? Where are they going for services and who is helping them?
So, Michael, thank you. Mr. Duarte, thank you so much for having me on this panel. Sarah, my peer, I'm going to say some similar things, but in the Department of Behavioral Health, we, as soon as, and even before the hospital closed, we started contacting our nearby partners in behavioral health and in the hospitals in Fresno, Merced, the nearby hospitals, just in case our clients, our residents would end up in their doorstep. Some of the crisis stabilization units that normally are used for folks who are suffering from mental health or substance abuse, our alcohol and drug programs. So we immediately coordinated and connected with them so that they could refer our residents back to our behavioral health department for the services that we offer countywide. So we also mobilized, we have a crisis cares unit. It is a mobile crisis response mental health team, bilingual, bicultural, who have responded actually to several situations in the community. And then, of course, if it's medical, we definitely connect them to the medical providers. I do want to publicly thank Camarena Health. They've been amazing. They did the urgent care. I mean, they've been they're everywhere. And we are so thankful to be partners with Camarena Health because they've been helping our clients with medical needs, et cetera. And definitely our public health department has been amazing. But our team goes out if necessary. They go alone, mental health response first. If there's a crisis or even if it's a non-crisis, there doesn't need to be what is called a 5150 or a 72-hour hold. Our team responds alone and or they go with law enforcement, and our police department, our sheriff department have been right by our side whenever we've needed to go together to a situation that may, we don't want to put our staff in any danger or any of the team members, but if it's needed, they've been there with us. We have seen an increase of contacts with our clinics. Bethany Shakespeare is our crisis continuum division manager, and Letitia Wilman is my assistant director here. They've been actively working with our clinics and to ensure that we are staffed appropriately, that we're filling our positions so that we can attend to and respond to the needs of the community. We're seeing a spike. We're seeing more contacts. We hope our community can trust us more and feel comfortable to come in. We offer a full array of mental health, alcohol, and drug services throughout the county. We have 4 sites, 2 in Madera being the biggest, and then we have Chowchilla and Oakhurst. We offer what we offer here in those areas as well. Mental health, substance abuse, we do evaluations, we do consultations, we do screenings, we do treatment, we do medications, case management, we do the whole gamut, substance abuse as well. So we are here to help. We want folks to call if anyone at any point in time is feeling very sad, very depressed, wanting to hurt themselves, please call 988. That is the line that is available, toll free, no cost, and there'll be somebody to help them and also connect them back to our department. So we are very blessed to have these resources available. We want folks to come in. Please find us. Like I said, we are in different locations. And again, we are here to help.
And Michael, if I could just add, I think what we've seen is we've seen influxes in patient volume to our other hospital locations, such as Community Regional, St. Agnes, Clovis Community, Mercy Hospital. What I've seen is a lot of collaboration and communication and creativity come from this as well. We've certainly seen a strengthening our relationships with public health and with, Madera County Behavioral Health and other law enforcement agencies, and just a wide array of different relationships that have been emboldened as a result of this hospital closure. I can tell you that as far as Camarena Health, what we've done is we've expanded our urgent care hours to allow for more additional access for those patients who have urgent care needs. We've expanded our staffing. We were able to absorb a number of the hospital staff that were displaced from the closure and brought them on board from front desk receptionist staff to medical assistants to billing staff and medical provider staff as well. We've internalized a couple of OB programs that we previously relied upon the hospital, and that's inclusive of non-stress testing for infants and during pregnancy. And so that's a program that now we offer at Camarena Health, as well as a diabetes program for women who are pregnant who need management of their diabetes, both programs that were not a part of our regular service offerings prior to the closure of the hospital. We've also been able to bring on board a specialty clinic made up of the specialists that previously worked in conjunction with the hospitalists, and this has allowed for patients to continue their specialty care with a specialist that they're familiar with and perhaps already established with. And then, as Connie and Sarah mentioned, just strengthening relationships, I feel that has just been a great outcome as a result of this very unfortunate event, has just been the relationships that have been formed and the cooperation to make sure that we're trying to fill the gaps that now exist.
Thank you, Dr. Ramirez, and thank you, Connie. Gracias for those answers. And Dr. Ramirez, you just mentioned, additional services, being able to kind of obviously pivot and be flexible to kind of meet the needs of the community. When you say gaps, what gaps are you seeing out in the community?
Yeah, well, we're certainly seeing gaps around urgent and emergent care, right? And unfortunately for us as a primary care provider, we're unable to meet those emergent care needs, but we can certainly try to help address those urgent care types of visits. And that's where we've expanded hours and added additional staffing to try to create more access for patients who may not need to go to the emergency room. And if patients are unsure, they can always come to urgent care, and we do an evaluation, we triage them, and if necessary, we can activate the ambulance service for transport to a hospital if it does require a higher level of care than we can offer.
Great, thank you for that. So obviously we hear a lot from the community, and some of the concerns or a question would be, what do we know about waiting times for here?
I can talk a little bit about emergency room wait times in Fresno. From a recent experience, St. Agnes wait time varied quite a bit depending on the day and the time. So there was, one day in which it was early in the day that the visit was, I've seen really quickly. Well, the second time I visited the emergency room, it took about an hour to actually be seen, but during that time, they were assessing other things. So I didn't feel forgotten, but there were a lot of people that were there and they were waiting. What took longer was the process once you're in the emergency room to really have the tests be done, the time to have those test results read, things like that, to figure out what to do and either send you on your way or admit you, whatever the outcome is. And so that has been true for a long time, but it really does depend on the day that you go. It's hard to get an average, and the emergency room is not going to tell you how long it's going to take, because I asked and they didn't tell me. So I would make sure that you have someone that you can be in contact with regards to transportation. If you didn't take the ambulance, if you drove there or had someone drive you there. I also would just plan on being there for a while. So obviously not wanting to interfere with any of your care, but think about some of the practicalities of being there for 8, 9, 10 hours. You probably want to have a snack in your bag. You want to have a book with you, bring your cell phone charger, things like that. And those were not things I was thinking about. And so I think that people just need to be prepared. Now, the quality of care that I received at St. Agnes was great. Everyone was super professional. They were very nice. They were checking in, they were communicating, they were very responsive to questions. It just took a while. So that's anecdotal, but I have understood that it really does vary depending on when you've arrived there and what other things are going on. Unfortunately, the ER is one of those things that they're treating things that are unpredictable. So it's impossible to anticipate how many people aren't making appointments to go to the ER. So you never know if you're going to get there and the volume is going to be lower or higher. But I'd be prepared to be there for between 8 and 10 hours, depending on what the issue is.
Yeah, I agree with Sarah. I think those are great recommendations about bringing your phone charger, carrying a book, and just expecting to wait for a while. I'll share that within our urgent care facilities. It is also very variable. We can have some days where we have low volume and other days that it just explodes and we don't really know the why behind it. So I will say weekends tend to be a little busier than weekdays. And the other thing I'll say to that is for patients to be aware that we have 2 urgent cares within Madera. Oftentimes they visit one primarily, and that tends to lead to longer wait times. And we will often share with them that we have a second urgent care location. And for many patients, they're unaware of that, and that facility tends to have shorter wait times. So just being aware that there's 2 locations for urgent care access at Camarena Health within Madera. As far as primary care visits for non-urgent conditions, we do try to schedule those within 2 weeks' time. We've dedicated walk-in slots on every single one of our medical provider schedules so that there's opportunity to absorb patients that do not have an appointment. And we also offer telehealth, which can help for appointments to happen in a more efficient manner because there's not the need to wait for an exam room to become available. We will call you at a time that's convenient for you, and that fits into the flow. So that's, as far as Camarena goes in terms of wait times.
Mr. Duarte, as far as behavioral health, so we are very blessed that we have our mobile crisis team that can see anyone, anywhere, anytime. And we are 24 hours a day, 7 days a week, 365 days a year. However, if anyone comes or needs services from any of our 4 locations, we offer walk-in services. We have a team that is on duty that triages, screens, evaluates who needs to be seen first, second, third, etc. We're also doing double bookings to ensure that folks can be seen when they come in. So I can tell you that for some of our clinics for mental health, folks, if they must wait for an appointment, would be under 10 days, but we do have the walk-in option. And then we do have the substance abuse assessments. Those vary throughout the county, but the one in Madera here on 7th Street, we have more available appointments. And again, we will see them on a mobile crisis basis and mobile services period in their homes, schools, wherever they're at. So again, anytime, anywhere, anyone. Thank you.
Thank you guys for your responses. I just want to welcome Dr. Mohammed Ashraf. He's just joined us. Dr. Ashraf, the question was, what do we know about wait times here in Fresno Madera? If you can jump in now, or you can just jump in our next question.
Good afternoon. I'm sorry I had a little difficulty to join in. Everybody's just giving such a good pictures of everything, and I don't know why. I don't know, you don't really have real story or not. I've lost 2 patients within this week, just not coming to my office because they did not want to go to St. Agnes or Fresno Community. They were having chest pain, they were having problems, but they did not want to go anywhere because it takes, number one, an ambulance. They're scared of Fresno. They don't want to go there. And once they go there, they do not see the doctors who they used to see. I've lost 2 patients. 2 patients died. One in her 60s and one in the 80s. Just waiting for the weekend so the Monday will come and see me. The patients, you have to look at the psychology of the patients. Patients want to see their own doctors. Patient wants to go to a familiar place. It's fine to say there's no waiting over there in St. Agnes and then no waiting in Fresno Community. That's not important. What's important is how patients perceive their care right now. When they're discharged from St. Agnes or from Fresno Community Hospital, people have no idea what medication they were taking. They don't know that. When things happen, I cannot even get records from Fresno, and I'm on the staff of both the hospitals. Patient has to come to my office. They have to sign a release records before I can get records of my patients from St. Agnes or Fresno Community. And this happens every single day. It's fine. Ambulances are coming, picking up the patients, but how many people are calling the ambulances? How many people want to go to St. Agnes or Fresno Community? The waiting is not that much. In my office, visits are open because now I have no referrals from Madera Community. I have no referrals from the emergency room. Thank God to Camarena, they're referring me patients to see. But those are elective patients. Emergencies is the main issue here. Thank you.
Thank you, Dr. Ashraf. And sorry to hear that you lost your patients.
I've lost 2 patients already this week.
2 patients. Yeah, I'm sorry to hear that. And well, this kind of flows perfectly into my next questions, 2 questions. And this is for all of you. You touched on this, but what happens to the chronic patients going to the hospital for ongoing care? Is there anybody following up with them to ensure they have a primary doctor in Fresno? And the other question that you touched on, Dr. Ashraf, is patients have also been experiencing delays in getting their medical records from the hospital. What can they do about this?
Again, like I mentioned before, there's some new laws, and as you've seen in the newspaper, almost all hospitals have been penalized for, giving their information to people. St. Agnes recently got fined. Fresno Community got fined twice. So they've become more strict. Unless you are the doctor on service at that particular time, you will not get the records. And what records they give to the patients, they absolutely have no information on that. And St. Agnes records right now are not done in St. Agnes. They're done somewhere in East Coast. If you're calling after 5 o'clock, which is their time, 2 o'clock over here, your records will not be available till next day. Luckily, Fresno community does not have that issue yet. They're able to get the records to us same time as the patient is there. Their medications are not taken properly. They're being discharged on medications, which are totally wrong, because our patients are not used to bringing medications with them. So when the emergency room or ambulance picks them up, they don't have any records what medication they're taking. And the family cannot go back and forth. Here, when I see a patient in the emergency room and say in Madera Hospital, I will tell the family, go home and bring the medicines. And from Fresno, that's not going to happen. And my patients have, hundreds of medications, and they interact with each other. A person is on blood thinner, and he gets a second blood thinner. So when he comes home, he's taking both blood thinners. So I don't know what we can do about that. We need to inform the doctors, at least get in touch with the primary doctor, so we can tell them what medication patient is on. I had a patient recently who was taking Xarelto and Eliquis both. He was on Xarelto from me, which is a blood thinner, and he got an Eliquis from St. Agnes, is a blood thinner. Now he's taking 2 blood thinners. They don't know. They don't know the difference. And, I don't know what we can do about that. Educate them, talk to them. I cannot run to St. Agnes and Fresno community for every single patient to take care of them. Otherwise, I would be just driving back and forth. I have privilege in both the places, but I go only when I have to go. And it's a big problem. And these patients, they have given when they're discharged, they're given the appointments for local doctors in Fresno. They don't want to go there. They cannot go there. So they have to come back to their own doctors, if whosoever is left in Madera. So it's really an issue. And I don't know how we can, I have no solution for that.
So I'll share that we operate a post-discharge clinic in Fresno, specifically for patients that are discharged from St. Agnes who do not have an assigned PCP. We've been functioning in that capacity there in Fresno for the last maybe 3 years, with the goal of trying to offer a primary care medical home for those patients that are discharged and do not have a primary care provider. So that clinic is still operational. It's in Fresno, and that's specific for St. Agnes ER and hospital admit follow-ups on patients that do not have a PCP. Our staff have direct login access to St. Agnes Hospital and Valley Children's Hospital so that we can retrieve medical records, have follow-ups with patients when they get discharged, so that we can perform medication reconciliation with them and ensure that they're on the correct regimens that were provided during their hospital stay. And we also receive daily reports from community, regional, and Clovis community if any of our patients that are attributed to Camarena Health happen to visit the ER or are admitted to the hospital, so that we can call those patients to follow up with them and have a post-hospital appointment with them.
In behavioral health, Mr. Duarte, we provide follow-up services for persons seen in crisis within 24 and 48 hours. And that includes navigation of, navigating appointments, referrals to other providers, and monitoring for continuous stabilization. We also have a hospital liaison staff that is dedicated for that particular service.
Thank you for that. So another question that I have here, what about continuity of care? Do you guys know, does anybody know whether Calviva or Anthem Blue Cross have followed up with their patients? And who is responsible for not letting their patients fall through those cracks?
I have spoken with representatives from both health plans, and they have been actively reaching out to their members to ensure that they are connected to their primary care provider, that they know that Madera Community Hospital is closed, the services that are available through Medi-Cal, and how to connect with Medi-Cal if they have any questions. They've been in the community in person as well as, you know, on the phone, sending emails. They are really reaching out to their members as much as possible. And so there is a real concerted effort there. And it's really a matter of people kind of connecting those dots, opening the emails, answering that phone call, and following through and learning about what they need to do with regards to how to use Medi-Cal appropriately. And there are some things about in health insurance, Medi-Cal or other private health insurance, that can be kind of tricky. You have to make sure that everything is connected back to your primary healthcare provider. So if you go to the ER, you have to follow up with your primary healthcare provider for all the reasons that have been discussed here from a medical perspective, but also to kind of close the loop with your insurance so that they know that it's authorized and that you don't get the bill for that visit. Instead, it goes through your insurance. So that's true of primary or private insurance as well as Medi-Cal. It's really important to be anchored with a primary healthcare provider. And from public health perspective, and I'm sure the other folks in the room would agree, the most important thing that we would encourage you to do today and with your family and with your friends is to connect with your primary healthcare provider. Make sure that you have a regular doctor who has your health history, that is able to treat you and get conditions well managed so that you can prevent hospital visits, but also so that you don't have any glitches with your insurance. So talk to friends, let them know, get enrolled in Medi-Cal if you're not, and make sure you're connecting with your primary care.
Thank you. I want to follow up, and I'm seeing questions from the community, and I'll throw those in. Don't worry, community. I will ask them. We've heard that many providers in Fresno don't accept county medical services, patients from Madera. Who's helping them, and what should they do? You guys have stressed the importance of a primary care doctor also. But what if they don't have one, or they need a specialist and they're not covered in their network?
So I think just, as Sarah pointed out, they are able to reach out to their insurance plan, whether it be Calviva or other, and ask about where they may be able to establish a primary care provider in Fresno or in Madera. There are a number of different entities that provide services for both Medi-Cal, private, and commercial insurance carriers. So there shouldn't be it shouldn't be too much of a challenge to find a primary care provider in either Fresno or Madera to be able to absorb those patients. And similarly for specialty care as well, their insurance plan can guide them as to which specialists are in network and would be covered entities if they were to see that specialist.
Thank you, Dr. Ramirez. There's a question here that we have in the chat. Urgent care cannot do x-rays on the weekends. It burdens the patient and overloads the Fresno hospitals. What is being done?
Yeah, I'll tell you, I don't know if that was specific to Camarena Urgent Care, but I'll respond to it as such. That's absolutely correct. We are unable to provide x-ray access for our urgent cares on the weekend. And to be quite frank, the reason is we don't have a staff member to shoot x-rays on the weekend. We've been searching for another x-ray technician. So if anybody out there in the community has certification to shoot x-rays, please reach out to us. We've been trying to fill this position for more than a year now. So we've got the ability during weekdays from a staff member who gives us hours of service, but this person wants their weekends off, and so we don't have someone who can shoot x-rays on the weekends. And so that's just the unfortunate reality.
Joe, the issue is whether as a private physician, we can order x-rays at Camarena or not. If we really cannot order x-rays over there, the patient has to be yours. So the burden continues to be with the Madera MRI, where
Yes.
lines outside the door. So
Correct.
is there any way you can open your x-rays that we can order x-rays over there? I know you require separate licensing and all that. Is that a possibility in future?
Absolutely, it's a possibility. The only reason we don't accept orders from outside community providers, again, is because we don't have the staff to shoot the x-rays. So even if we said, Dr. Ashraf, we'll go ahead and order x-rays, if that patient comes in on Saturday or Sunday, no one's going to be able to shoot that x-ray. So
No,
it's
I'm talking about even
Madera
weekdays.
MRI.
No, I'm even talking about the weekdays. Can we
Yeah.
order weekdays x-rays?
Yeah,
Can we
so that's
send-
something that we can, that's something that we could put into place. And you're absolutely right. Right now, the burden of imaging is falling on Madera MRI. I know they're not here to represent themselves, but I'll tell you that's who we've turned to since the closure of the hospital to be able to carry the load of our imaging needs, whether it be plain film x-rays or CT scans or MRIs, and they've really stepped up to the plate to be able to meet the demands of our
That's right.
imaging needs.
Thank you guys for that. Sarah, this question is directed to you. What should we do as a community if we can't get a new hospital? Who should be leading that charge to get a new one?
There's a lot of work already being done to establish a new hospital. And I hesitated with that description because there's also assessment that's being done around what kind of facility and what services that facility can offer that is sustainable from a business standpoint. And so there's a lot of analysis that's been going on from the county as well as a contractor that they have hired that has expertise in this area to identify what are the possible scenarios for opening up a new hospital and what are the pathways to getting there. Because the hospital is now in bankruptcy, that's really complicated. There's lots of layers of how complicated that is because a bankruptcy judge now resides over that. And so sharing of information can be cumbersome. And so there is a lot that's going on right now. Much of it is not able to be shared because it involves attorneys and non-disclosed information. Legally, it cannot be shared. But the county is looking into various scenarios in which they might be able to acquire the current property and then assess whether or not it's leased out to another entity or sold to another entity to have a hospital or something in some configuration in that facility. So there are a couple different scenarios that have been entertained, and this is public. The first, it would take a long time, but would be really great for Madera and really great for the Central Valley. And that is a UC Merced or UC San Francisco medical hospital, a medical teaching hospital for those who are studying specifically at UC Merced. That would take many, many years to put together because it would involve a significant investment into the facility. That facility is not brand new. And by law, California is requiring all the hospitals to be retrofitted for seismic, for earthquakes. And that's very expensive. Plus there would be the expense of staffing back up, which in our area is a real challenge. As Dr. Ramirez just shared, they've been looking for a year for an X-ray technician. So attracting all of the personnel that it would be required is going to be expensive and take some time. But if it's a UC facility, it's far more likely to attract high quality clinicians, which is what we're hoping for. So that's one option. Another option that we're exploring is to have and it's called different things. It doesn't matter what it's called, but an emergency room with some inpatient beds that people can only stay for a short period of time. So that emergency room would really be for the purpose of being able to triage, assess what's going on, get patients stable. And if it's something that can be treated without surgery or ICU stay or something like that, intensive care unit, then they can stabilize that patient and discharge them home. If they need to actually be admitted and have something that's more intensive, they would be medically transferred to a full service hospital. That emergency room scenario would probably be paired with other kinds of things that would support our community from a health perspective, like skilled nursing facility beds or inpatient mental health beds, or other treatments for chronic illnesses, like dialysis, for example. And so we're exploring all these kinds of options of what it might look like. It's pretty clear that the hospital that we had is not sustainable from a business perspective. And so we have to look at how it might be different in order for us to have something in Madera that will stay open and continue to be able to serve patients. And that means we need to look at things a little bit more as a region, and how do we supplement and add to the infrastructure that we have in our region from Merced down into Fresno.
Sarah, so what, as a physician, what can we do to help you guys in this? Because one of the problems with, has happening before is the physicians are never consulted into this. And without physician, you cannot have a hospital. So what, as a physician, what can we do to help you to work through either the, UC system or the other scenario? I mean, we still have a group of about 28 physicians who will still meet, we still get together, and how can we help you in this?
I'm really glad that you want to be helpful. And right now at the place that we're at, it's really, it's at a critical juncture, but it's wrapped inside of the bankruptcy. And so if you'd like to talk offline, I can connect you with county administration. And if there's any way that we can work together, we absolutely want to be collaborative in this and work with the physicians that have been so dedicated at Madera for such a long time.
I mean, I've been here for 42 years.
Yes, I know. You are so dedicated.
That's right. And I decided not to move. And my other colleagues, I have about, like I said, another 27 physicians who are willing to come back and work and help you guys. I'm meeting constantly with the, with the assemblywoman and the senator, and they're willing to help us. But you are the leader. We want to, help you so you could do something for, for the community of Madera County. My number is available anytime. I don't know who I call. If you let me know who I call, then I call somebody, and whatever we can do, we will do it.
I have your email, Dr. Ashraf, so I'll reach out to you.
Okay. All right. Thank you.
Thank you, guys. And I'm glad we're making connections here. This is good stuff. I just want to keep track of time. We have 5 minutes left. We will end at 7 o'clock on time. I'll be respectful of your time. I do have a quick question from the community again. I'll read it off. What do we do for emergency suicide ideation or an attempt to a person's life when we don't have an ER?
So, Mr. Duarte, what I just want to say what I said at the beginning. If anyone is having thoughts of self-harm, please call 988, and always have our access and crisis line handy, 559-673-3508. We put it on the chat. We will respond to anyone's home, school, wherever they're at, county-wide. We have a team available, like I said, 24 hours. We do 7 days a week, 365 days a year. And like I said, we do have folks that can talk on the phone, or we can have folks brought in. We do the evaluation. And then if we must have that person, by ambulance transported to a psychiatric hospital, we will. We are also very close to having our local psychiatric hospital. 120 units will be opening everything goes well, towards the end of June, very soon, for all ages. So we will not have to, transport someone out of the area. It will be right here, right by Valley Children's Hospital. So again, we are bringing more resources to Madera County so we can help align with the national initiative of zero suicides. But we please ask people to call us, and please ask people to dial 988. The calls, they will connect folks, our residents, with us, and we will respond quickly. Please, we're here to help. And we have bilingual, bicultural, and also languages, so let us know.
Great, thank you, Connie, I appreciate that.
We do have one from the library, so I will let you guys speak, okay?
Thank you all for everything that you do. And my name is Sandy. I used to be a volunteer at the hospital, and I just loved it. What I wanted to say is I noticed, well, just as a regular person here, we have new homes and new stores and a lot of new people coming in, but we have no hospital. Yeah, as we all know. And what can we do as average people to help out? I pray a lot. Okay. From what I understand, through a couple of nurses at Kaiser and through, I'll say in Modesto, is that if we go to an ambulance, get into an ambulance or one of our family members, we're not to go to Merced Hospital at all. And I understand, I listen to, well, it doesn't have anything to do, but I listen to America's Real Voice, and I understand that there's a real bad case of TB coming through. So thank you for this time. Thank you for everything you do.
Andy, I thank you for your comments. I just want you to know, first of all, that with regards to tuberculosis, that is one of the diseases that is reportable to the Department of Public Health. We monitor any case of TB very closely. If you recall, during COVID, we talked a lot about contact tracing. That is where contact tracing is actually really, really valuable, because TB requires some fairly close contact and for a pretty significant time. And because TB has a kind of a slower onset to the actual illness. I don't know if I'm saying that correctly. I'm not a clinician,
Yes.
but it takes longer.
Yes,
It is easier.
incubation
Yeah.
period.
It is easier for us to be able to do the contact tracing and really make sure that we're providing treatment and we're stopping the spread of TB. So TB is one of those that we're less concerned about from an epidemic standpoint, because it is easier to control than, say, something like COVID, because that's most people are familiar with that process. The other thing I would share is, as a private citizen, I think anything that you can do to encourage people to improve their own, what we call health literacy. It's all the things that we've been talking about today, that encouraging your friends and family to become familiar with how do they access healthcare. Think through ahead of time. What are you going to do if something happens? Do you have a primary care physician that you can call and you can contact? Do you know which urgent care you're closest to? Do you have someone that, if you don't have transportation, that you can coordinate with and get help from? Do you know the number of the transportation support for Medi-Cal? Like, all of these questions that we all would have to figure out if we got to that point that we needed the healthcare. If we could ask those questions ahead of time, so that we have a good plan in place of what to do, so that when we don't feel good and we're stressed, we can just pull out those notes and go through it and have the numbers right there. Make a list of your medications and what they are, what the dose is, the frequency that you take them. put it in your phone or write it down and put it in your wallet. So if you end up in the emergency room, you don't know what your medications are. I couldn't list my medications to you. They're in the cupboard, but I have them listed in my phone because I want the doctor to be able to know what it is that I take. And so all of us can do steps now that can make the healthcare that we need more effective when we need it, that we can get to it better and faster, and that it's more effective. So I don't know if the physicians who are actual experts in the room want to add to that.
Yeah, few things I really want to, people who are listening, especially what has been happening for the last few months, I've learned. Number one, all patients who are having problems, they need to go to the emergency room. Don't wait for the weekend or that your doctor is not available. Please do not do that. And I know it's waiting, but at least you're somewhere you could get taken care of. That's number one. Number two, you already mentioned about the medications. And that's a very good point. Make a list, have it in the phone, and have it available. Moment you go to the emergency room, please tell them who your PCP is, who's your doctor. It's very important because they're not calling us anymore. So please tell them who's your doctor, because we have all the information about you. And moment you're discharged, come right away to your doctor so that we could review your medications. We make sure that you're not taking medications which interact with each other. This is very important. We can save lives, but main thing is go to the emergency room. That's very important. Thank you.
Thank you guys for those responses. So it is past 7:04, so I did lie. We did go over 7 p.m. So which brings us to the end of the webinar. I want to thank all our panelists for being so generous with their time participating tonight. To the audience, just be reminded that next week, June 15th, we will feature guests such as Assemblywoman Esmeralda Soria, Senator Ana Caballero, or one of their staffers to discuss their loan program that they've been working on and the bills that they've been passing. So following them, we'll have also County Administrator Jay Varney. So stay tuned for that. We do have that information on our social media. So follow us on Facebook and Instagram at Madera Coalition for up-to-date information regarding the hospital. Once again, thank you to all you panelists for taking the time. I want to also thank the Madera Coalition community staff that are working tonight and our community members that participated. So with that, we will end the webinar and thank you for your time.
Thank you. Thank you for having us.
Thank you.
Thank you. Have a good evening.
Thank you very much.
Thank you.